Hey guys, I'm Dr. Cosentino, President of Empire Medical Training, and I'm super excited today. We have a great topic, and also we are here with the renowned Dr. Faride Ramos, who's an industry specialist in functional medicine. We have a great topic, especially for men. Our topic is men's health over 40 with an emphasis on hormones, so hormone health for men over 40. I'd like to start. Welcome, Dr. Ramos. Thank you for being here. I'm very, very excited to be here with you. And just a little bit about your background. Dr. Ramos she's actually dual board certified in internal medicine as well as functional medicine, formerly anti-aging. Now the term is functional medicine. And I just want to ask you, you did a lot of internal medicine, and of course you transitioned to functional medicine. Can you just share with everybody, why did you do that? Why did you get into functional medicine? What were your interests to do that?
Well, I was tired. Like a lot of my patients, they were tired of not getting any answers. And conventional medicine is great. Obviously, it's one of the foundations in medicine, but the reality is that it's disease oriented. It's not prevention, it's not root cause medicine. So that's where functional medicine attracted me, because I really wanted to see my patients to start healing. And it's very complex. As human beings, we are not just one thing. And that's another reason why, because in conventional, we're just targeting one at a time, one organ, one symptom. No, we're not taking everything globally. In functional medicine, we do. So for me, it's complementing, it's really getting to the root cause to start healing, because that at the end is what we're trying to do in medicine. And that's our oath, is to really heal and help patients to have a healthy longevity. And prevention is another reason why functional medicine marks the difference in compared to conventional medicine.
So from a personal standpoint, I mean, I would imagine you enjoy functional medicine better. Your lifestyle. Like
Correct.
we hear, we train a lot of doctors, we train a lot of providers, healthcare providers, and we just hear so much that they enjoy the lifestyle better. I mean, you're not dealing with insurances,
Yes,
right? So
that's
maybe you could.
another great aspect, because we really have the freedom of getting to, give all the different options in the real medicine, and not necessarily what we are dictated by insurances, which again, sometimes I use it if they are paying for, why not? If you can do some lab testing or,
Okay,
things in
okay.
that nature. So we can do a hybrid kind of methodology if you would like to. And that also helps patients if financially they cannot afford everything, cash. So there are ways that we can definitely make it managed, but it's the freedom that we have in functional medicine. It's spectacular, because we really get to do all these more punctual and personalized testing that in conventional medicine we don't have, unfortunately.
And we also see providers that they really enjoy. Obviously, you're helping people, so you're doing something very good. And how many specialties are there? I mean, there's so many different things, but how many specialties where you can see the result of what you're doing? People, you're helping them feel better, you're helping them look better, and something else. And I would imagine this is the case. Looking at you and talking to you and knowing you, that you live the role. So as a functional medicine doctor, and we tell people this also in cosmetic and aesthetics, to actually try out what they're doing. So if it's like a Botox injection, we always tell them, have these procedures, know what it's like. But if you could tell everybody, you live the part too. You're not just a practitioner.
Exactly. No, I have done all the testing also I have my doctor, my functional doctor. So I have done all this testing. I have, determined what works, what it doesn't, by my personal experience and obviously the clinical evidence. But it's something that I put in practice with me, with my family members, because they are part of my life. And it's all the mind-body connection, spirituality, and everything that it takes to really get to a balanced, optimal level in life, to really get to, again, the optimal healthy longevity. That's what we're all looking ultimately to have in life, right? So it's a conjunction and having everything in symphony that it makes a difference.
Okay. All right, let's get down to like something very important that people
Yes.
ask all the time. So testosterone replacement therapy. The typical person, the typical patient we have is the male who just maybe wants to look better, he wants to feel better, he wants to build muscle. He's heard from one of his friends that you got to take testosterone, you're going to look better, you're going to feel better. It's the best approach. So this patient comes to you now from a friend. How do you approach this person? Because everybody you're not going to put everybody on testosterone just because
Correct.
they feel like they need it.
Yes.
So how, from a medical standpoint, what are some things that you're going to do to evaluate this person to see if they need testosterone or not?
Yes. So number one, symptoms. And symptoms are very important because it can manifest in many different ways, not just, the muscle mass or the way they look, but also the way that they are feeling internally, mentally speaking, if they are maybe more forgetful, if they're not sleeping well, if their energy is not the same, if their skin is drier, if they're losing hair. Like, it's so many other manifestations that you guys can have, and you might not make the connection. That's why when you come to me, I evaluate one by one, symptom by symptom,
And you're
head
not
to
even thinking
toe.
about those
And you're not
things.
even thinking about it. Like, even if you slow down your bowels, like, okay, I'm more constipated, or I'm now having diarrhea, like things that they were not clearly happening before. And as you know, the hormonal symphony starts getting, bad in a way, like not optimal as it used to be when you were in your 20s, then your body is talking to you. So you have to listen to your body, because that's the key. So number one, symptoms. Always you have to relate to what your body is expressing. And then we're going to go with the testing. We correlate testing. And testing is not just blood work. We have urine tests. We have saliva tests, as you know. We have a stool test. So our body, there is the reason why we have so many specimens is because there is not only one way that we really can detect whatever imbalance you might have. We need to really put together all of those in order to get to a final diagnosis and properly manage, personalize whatever it is that you need, because it's not only the testosterone. There are so many other hormones that they play a huge role in getting optimal levels and to feel and to look better.
And I'm thinking about some of this because I didn't mention this earlier, but I'm not just, let's say a doctor, also an educator. I'm also a patient of Dr. Ramos. So as you're talking about some of these tests, I'm remembering all the different tests that you put me through. They're not difficult tests or anything like that, but they're very specific blood tests. They're very specific, all sorts of lab tests, urine tests, saliva tests.
Stool
and,
tests.
And I remember just the conversations we had and the feedback on what we need to do next, because
Correct.
it's not just clinically.
Exactly.
That is the step one, the symptomatology and so forth. That is the step one. But the lab data is so important.
So important.
And that's what makes, I think that's part of what makes for a good functional medicine practitioner,
Yes.
is knowing what test to do and how to evaluate. Do you want to mention maybe just a few or so? I mean, obviously, you're going to check their testosterone level. What are
Yes.
some other tests that you may look at?
So in order to connect the dots, because that's what it is, finally, it's to get to connecting all these puzzle, because it's kind of a puzzle, right? You need to really get all the different hormones, not only testosterone, but we have also the adrenals that they play a huge role. So cortisol, and a lot of people, they're like, oh, cortisol is like the unknown hormone. It's like everybody pays attention more to testosterone and thyroid, but the cortisol, it plays a huge role, and actually is the first one. It's the one that is playing the symphony in all these hormonal balance. So that is urinary or saliva test. And also we have other hormones like pregnenolone and DHEA that are also very important in the adrenal balance to help testosterone to maintain well, to help estrogen, because it's also important for males to have a good optimal estrogen level for brain connection and many other functions. So it's, again, is the blood work, as you were mentioning, that data that it really helps to connect the different dots and to get to a final diagnosis. But those are some of the biomarkers that we can do. Apart from that, we have the nutrient testing, which is very important, because that's the way that you will maintain your hormones naturally, speaking in your diet. And also if you need certain supplements, and not supplements is like everybody will need the same supplements. It really depends on what those levels are. And that's why testing, instead of guessing, is so important.
Okay. I'm thinking about that same person now, that male patient who's coming to you because he wants to feel better, he wants to be stronger. A lot of times men come because they want their bodybuilding, they want to, gain muscle mass, and they want to look and feel better.
Yes.
So what else is there other than just testosterone? Because in their mind, they're thinking, I'm going to get more testosterone, I'm going to feel better, I'm going to build muscle. Other than testosterone, what other hormones, supplements should they be taking to accomplish this goal that they want to reach?
So exactly, depending on the results, again, if you need to have more or certain nutrients that are going to help, amino acids, right? So those nutrients are very important. And some people, they do brand change amino acids post-workout, vitamin C, excellent as an antioxidant, also for muscle support, certain peptides that are going to help to support growth hormones, not necessarily as a growth hormone by itself, but they are analog. So they behave as without all the risks associated with a growth hormone. So those are other modalities that it will help you to really get to a good muscle mass and maintain and support your bone mass, because males also, they can have osteoporosis and osteopenia, which is another manifestation, when there is hormonal imbalance and low testosterone.
It's amazing how much education, the patient really needs to become educated.
Yes.
Because they're not doctors, they're not practitioners, they have a certain knowledge that they're coming in, but when they come to see you, they're going to leave there as they're going to feel like they really know a lot, because you're going
Yes.
to educate them whether they like it or not. You're
Correct.
going to teach them so much
Yes.
as far as what they need, and it's good because you know so much about this, you know. But if we could just talk a little bit again, and I'm thinking again from the patient side of things, okay. I'm thinking about the typical patient. This was myself as well. Like feeling great when you start testosterone,
Yes.
you really do feel so much better. I mean, comparing how you started before, feeling maybe a little bit fatigued. You're taking testosterone, and there's different ways. Maybe we could talk about that. There's the injection. There's
Pellets.
the pellets and so forth. There's so many different ways, but
Yep.
they start to feel better. So what is the inclination? The inclination is, I'm taking this dosage now. I want to increase. All right, and it's so contrary to what you want to do.
Correct.
I know you want to reach optimal levels, but what are some of the side effects or some of the reasons why you don't want to just increase the testosterone? What are some things that could happen?
Yes.
Some values that you need to look for?
So risks that you are exposed to if you don't do it correctly with your practitioner are, red cell. It can go so high. Red cells are the ones that they carry oxygen. If you develop so much, that can put you at a high risk for blood clots that they can end up into heart attack or stroke, right? So then we have also the prostate. The prostate can get affected if the testosterone is way too high or is becoming estrogen, which is something that we also manage. Then the prostate can get enlarged. Not necessarily that it's going to lead to cancer, but it can predispose you to problems. And if you already have, some genetics, that can also, give you some problems there. And, blood pressure issues, headaches, and many other manifestations, but you have to monitor. It's like thyroid hormone. If you don't monitor, you're gonna have issues and you're gonna have problems. So this is another hormone that you have to have all the time, continue monitoring in order to prevent. And that's why blood tests, 3-4 times a year, it's ideal until you reach a good optimal level. And after that, you can just have it twice a year.
Maybe you could say a few words also about, because a lot of those side effects, I'm thinking about the person who's 40 years old. They're not thinking about a heart attack.
No.
They're not worried about that.
Correct.
But more immediate side effects. For
Yes.
instance, maybe if you could talk about how testosterone will convert to estrogen. You end up
Yes.
with a high estrogen level, which
High
is the
estrogen.
last thing that a
Correct.
bodybuilder or even just the average male wants to get. Pregnenolone,
Yes.
how it affects that, because these are more immediate effects.
Correct.
And we don't want that patient to end up with that.
Correct. So if you continue like overdosing, which is pretty much some people they do because they're just, as you were mentioning, they want more the energy, more the muscle mass. So that's where, these estrogens can be the actual more predominant hormone. And that's where, breast tissue can end up also being a problem. So you can have more enlargement of the breast tissue. And they can also start having fat, in their belly, which there's something that they are like, okay, I'm trying to lose weight. Why I'm gaining here because of the estrogen dominance. So those are the things that you have to watch for, and you have to be educated, and you need to be patient, because like any other hormone and anything else we do pretty much in true medicine, we need to be patient and let the body heal and adjust and have a good, optimal level that you are not rushing. Those peaks, ups and downs, those are worse. It's like blood pressure going high and low. That's when people can end up, having a stroke or a heart attack. So you want to go slowly, a steady level, slowly but very strong, and then you can get to that optimal with, minimal risks.
Interesting. And then also people talking, you see this a lot, asking what level, what's your level? I'm at 1,000, I'm at 800, I'm at 1,100. Is this different for everybody, or is there a standard range of testosterone that a person should be at?
Yeah, it goes by age group, but we have not only the total level that it can go. Obviously, if it's below 200, it's completely insufficient, and that's when we really need a true replacement. But if it's something between 400 and 600, depending on the age group, that's when we're doing a boosting. And that's the difference. When you're having a high dose, you're truly shutting down your natural production. But when you are more in the boosting, you don't want a high dose of testosterone because you're completely shutting down your own production. So that can range. And most importantly than total is the bioavailable and the free portions, which is really what we go by, because it's not just the total. The total is combining the active and the inactive testosterone. We really want to follow what is the active portion. Are you really getting that inside the cell, which is where we want to be, because you can have 1,000, but your bioavailable is really low. So you're doing nothing. And then all this total, it's going into estrogen level or dihydrotestosterone that it can also affect and give you acne, irritability, which is also one of the side effects that you can have more immediately. So acne, irritability, hair loss, hair in the back or unwanted areas. So this is all more because of dihydrotestosterone. So that's what you also want to be very careful with.
Wow,
The
incredible.
dosages, how it is in age group, and not only 40s and more, but below 40s. And I have that happening lately, that younger patients, and it's because of all the contaminants and lack of nutrition and exercise and good sleep, and they started having low testosterone in their 30s. So it's not even about the age, because it's all what you're eating and doing on a regular basis what is going to mark the difference.
So functional medicine practitioners, the way I see it, they're like scientists. I mean, you guys are taking apart every aspect of everything, and really analyzing it. And a good practitioner, a good functional medicine doctor or practitioner really needs to understand the whole picture.
Correct.
It sounds simple from the outside. I'm just going to go, I'm going to have some more testosterone, I'm going to feel great. But that person, I mean, advice to, let's say, somebody who's 40 years old or 45 or older. We were talking earlier about it's not just, we're starting with age 40, but you have many patients, you were telling me, that start much younger. But just generally speaking, advice for somebody who's looking for a practitioner, what would you tell that person, about that practitioner?
Go and talk and just, say all the symptoms you're having and have it tested first. Don't just go by, my friend is doing or my brother or whoever. You have to personalize whatever you do, because this is your health and this is your life. And it's very risky when you just do it and, I'm going to copy whoever is doing it because it's having great results. Every person is unique. So whatever is working for this person, not necessarily is going to work for you. And you can end up with more risks associated with the excess of testosterone or converting the testosterone in other hormones, which it can be even more critical.
For sure. And then how about if you could give advice to, let's say, a practitioner, somebody who's an emergency room physician or a general practitioner, a nurse who wants to do what you're doing.
Yes.
They admire, they inspire to do what you're doing, because it is really such a great field.
Yes.
What would be some advice that you would give to that person who wants to get into it? Where do they start? How do they get into this field?
We're here at Empire Medical Training. We have great, certifications, courses. We have a good of different activities that is gonna help you to start in learning. Because if we learn, we are an instrument for our patients to really pass and educate them and have a good life and a health, longevity, healthy longevity that we're looking for. So we have anti-aging, courses, we have weight, we have hormones. So it's many different courses that if we educate ourselves, this is gonna be for our patients. So that's my advice, that if you really want to get to someone that is truly accredited, that they know what they have been doing for years. So practice, experience, knowledge, number one.
Okay, that's great. And one other thing I'd like to ask you, because obviously the topic of this focus is we're talking about testosterone replacement therapy, we're talking about functional medicine, but there's so many things, even that you've helped me with, which is so interesting. I'm thinking, off the top of my head, what are some other things that a functional medicine practitioner can treat other than testosterone? There's so many areas that you're helping people. What are some other things that the field of functional medicine could help the general patient with?
Yes, from pretty much head to toe, to be honest. Because if you really get, again, like what we were talking initially, we are so, complex. We are a complex species. And if we really just concentrate on one thing, we're going to make a big mistake. We really want to get to the bottom and exactly put together all the different pieces. So mental health, so neurotransmitters, so looking into the chemical messengers, looking into your cardiovascular, so everything about your heart, your blood vessels, your circulation, your GI, gastrointestinal, which is very important, and everything gets processed through the GI, starting from the oral cavity. So even all of that is very important, and we also manage that. So pretty much from head to toe, everything, skin, hair, nails. So we really analyze and detail and put apart and then put together what really it is that you are lacking that we can get better. Because again, we need to put all these puzzle back together and get to the great result that we're looking for.
And in your practice particularly,
yes,
or do you only do functional medicine? So let's say somebody wants to come in just for a regular checkup. They don't even know about functional medicine. They're not even thinking about testosterone. They just want a general doctor.
Yeah.
Can they come to you?
Yes.
And then you're going to see them, and then it's going to progress. You're going to incorporate your knowledge as an internal medicine doctor and as a functional medicine.
Yes, it's integrative medicine. That's what we call it. And it's all prevention because, and when they come like that, that's the actual best time to come because you really want to prevent and you want to get to earlier, stages of whatever it is, because it takes up to 10 years to really get to a disease, what we call a disease. It's complex and it's multifactorial. So in order to get there, take action. So you want to really see it now. You want to start tests. You need to really know what is it that is not working properly, and then we can avoid getting into diseases.
One other thing that I think is pretty cool about functional medicine and integrative medicine, as you just mentioned, is, I mean, there are other fields like this too, but it's always changing. There's always new topics.
Always.
There's new things.
Yes.
How are you? I know how busy you are. All right, you are super busy in your practice. How are you staying current? Like, how does a good functional medicine practitioner stay current with all these new things that are coming out?
Yes, well, you have to have the passion there. You always have to have that, like energy and enthusiasm to really keep learning, because again, if you learn, you're passing it on your patients for their own benefit and their longevity. So it's anything is happening, conferences, symposium, and again, Empower Medical, which is helping us and putting it all together and really get to, easy ways that, because we're always busy. And if we can have online lectures that they're accredited, that's the best way. We always have to keep educating ourselves. So, the Institute, Empire, it's one of the examples that, I encourage my patients and also practitioners to look into, and they can educate, because educate is a way that you're really helping yourself to put everything in practice and to carry on, because it's not just, I'm going to give you whatever it is. You need to be consistent. You need to be compliant. Otherwise, it won't work, like anything, right, in life.
The reason why I like your answer so well is
Yeah.
because the first thing that you said is the passion.
Yes.
It really does start with the passion. How are you going to get somebody to study and to do this extra work if they don't first have the passion?
Correct.
So that really is the first thing,
Yes.
is the passion. So you could see that you have that
Yes.
in your field. So I think we covered a lot. I think this is a good place to wrap it up. I do have one more question I was thinking about, and this is more about the typical person that's out there, the typical male, whether they're 40, 45, but probably what do you think is the biggest misconception that that people have about coming to a practitioner like yourself about getting into testosterone therapy, and how do they overcome that misconception?
Yeah, so education, number one, because as we were mentioning before, if they really don't know what the testosterone are, the different benefits and risks associated with doing this type of hormone
Okay.
therapy, they're going to get in trouble. Yes, there are the benefits, about doing it when it's correctly done, the dose and all the different ways, modalities that you can use testosterone. And at the same time, people, they think that's the only answer. And they need to really get to test and determine by your functional provider, okay, what exactly it is that I'm lacking, because it's this, that symphony that I was telling you before, that if we synchronize everything, that's going to really get us to where we should be. So it's not just because of the testosterone. It's many other different aspects in our health that it takes a place, and it really gets to determine what is it that is creating this symptom or another symptom or whatever it is that it's,
I see.
the problem.
There's so much information that they really need to get this information.
Yes.
There's so much out there. There's misconceptions, and I think with a consultation, with a sit down consultation, they could probably easily get all these answers and feel good about their treatment, because the treatment that they decide, and think about it, it could be for life.
Correct.
And it's affecting their body, so they really need to know everything about what they're about to do to their body. This was a lot of fun, Dr. Ramos. Thank you so much. I learned a lot myself, and I know our audience learned a lot. If all of you men who are watching, if you like content like this, visit our channel, visit our website, empiremedicaltraining.com. Of course, you could also visit Dr. Ramos's social media as well, which is
Integrative Medicine of South Florida. And also you can call the office 754-732-4300, so you can know more about my practice and everything that is related in functional and internal medicine.
But thank you so much. This was so much fun, and we're going to keep doing this.
Thank you so much.